Action.
So, name please?
Jeff Capps.
So Jeff, we had some issues that you're dealing with. I'd like you to tell me a little bit about the problem that you were having when you came to seek care here.
I was involved in a bad crash in the early 2000s. It was misdiagnosed and thus not treated properly. In 2009, I developed so much soreness in my shoulder and I was unable to move it. It actually would lock out on me. And I went to have it looked at and they wanted to replace my shoulder and I wouldn't allow that to happen. Too young. So they reconstructed my shoulder. I had torn bicep, torn labrum, multiple bone spurs, and it was so weak they had to go in my back and pull the muscles up tight to put everything back in place. That lasted up until about 3 years ago, and I started going through some changes and I lost strength in my shoulder, pain returned, and it got to where when I met you, I was to the point where I couldn't even put a pair of shoes on, hold a shoe up in the air. Could not thread a belt through my pants at all. My arm would not go around my back. And I needed help. And I was to the point where I was looking at wanting to have it replaced.
Gotcha. So then we kind of discussed a little bit of regenerative medicine. We kind of gave you that option of going through stem cell therapy through regenerative medicine. So tell us a little bit about when you had that procedure done and how are you feeling now after you've had the procedure?
Well, to be quite honest, I was very skeptical about that when I first met you with the conversation. I was looking to you for more chiropractic help, and you were very adamant that you could help with my shoulder. And to be honest, very candid, in a very short period of time, I started to have more mobility through my shoulder. The long-term prognosis was I needed to have the stem cell. I had that done and right around the first part of December. And within a good 10 days, I could feel a difference in my shoulder to the point where something is sleeping at night, I would roll over and my arm would hurt so bad, my shoulder. Within 10 days, that was gone.
Wow.
I didn't have any of that. And it's the simple things that you take for granted, like putting a belt through a pair of pants. All of a sudden, I went to get dressed one morning, and without even thinking about it, I ran my hand around my back and brought my belt through, and I was, wait a minute, how did I do that? And I did it again, and I was unbelievable how much mobility I had in my arm. Now, fast forward to today, 3-some months later, to me it's simple, but I can put 45 pounds in one hand over my head. And I couldn't even pick up a shoe and put it up over my head 3 months ago.
Wow.
So
That's
that's
You were telling me that you were doing some benching and that you were saying you're up to 200 pounds in bench and you couldn't even fathom that idea before.
In December, I've been lucky if I could got the barbell off, 60-pound barbell off the forks. Just the pain and the inability to move my shoulder, had no fluid. You could hear it popping and grinding. And now, incrementally, and with you stretching me and working with me, 200 pounds goes up with me like not even thinking about it. And I'm progressing steadily ahead. You got to be smart about it and not do something stupid. But my ability to move and have my life back, a quality of life with my arms and my shoulder. Today, working in the yard, I could not have done what I did this morning for 3 hours 3 months ago. Would never been able to do that.
Wow, that's powerful.
And no pain meds. I haven't been on any pain meds since December.
Wow, very awesome. So someone that might be like on the edge of their seat, should I do a stem cell shot? Should I not do a stem cell shot? What is stem cell? What would you tell that person? What would you tell them? Hey, go for it, not go for it. And if you could tell it to the camera and just pretend the camera is a patient that's on that verge, what would you say to that person?
Actually, I've had this conversation with a couple of people already that in my career field, this is quite common for joint replacements. As you need to listen to this and kind of follow this through and do your research. Having already had a knee replacement, I can't help but think that had I not had that done and gone this avenue, I would be a lot better off than what I am right now. And this, you have to think that when I look at the success that I've had in this shoulder. I know moving forward, my son is looking at having surgery and they've already told me, we got to replace your knee. No, we're not doing that. We got somebody else you can talk to about that. I have other friends with their back issues and they're looking at other things. No, this is what you need to be looking at. My concern was the money, but having did my knee, It was $7,000 out of pocket with insurance. So why not spend that money on something progressive that gets you through, and they're not having to replace yourself with plastic parts or metal parts? This is completely mine, and it's healed, and I'm stronger and better for it, no doubt.
Awesome. Well, thank you so much, Jeff, for your testimony. It's been a pleasure working with you. And again,
Thank
appreciate
you.
your time.
I look forward to continue working with you.
Perfect.
Thank you.
Awesome.